Hello, I'm Leslie Basham. I'm the President and Chief Executive Officer of Surgical Directions. I'm joining our podcast today to talk about the 5 biggest healthcare trends that we're seeing and how they're impacting hospitals and health systems and how they deliver care across America. 2024 has been an interesting year. We're coming off a soft economy, interest rates are higher. There's a tremendous amount of financial pressures on healthcare systems today. So, our number one trend is that margin compression and what's happening with the decreased reimbursements and the increased cost structures, and what that squeezed margin is doing on health systems and how that's driving their behaviors and actions. The second trend is around workforce shortage. Uh, since COVID, this has been the penultimate problem in healthcare, which is we do not have enough nurses, anesthesiologists, caregivers, even within central sterile processing, to be able to deliver the care at the levels that we were doing pre-COVID. And so, how are we thinking about attracting and retaining our workforce, but also thinking about how we create well-being and balance and wellness in hospital and health systems, employee base, and workforce. The third trend we're seeing is around cybersecurity. And this goes into how are we protecting our data? There's large cybersecurity actions that have happened within healthcare and across the world that have very costly impact on organizations, not just the organization that had the attack, but any organization that is related or any patient or consumer that is related to that organization. The fourth trend is around the rapid advancement in technology around artificial intelligence, AI. There's so much change in how we interact and how we can get work done and deliver care. And so how are we taking that into account and changing all of the processes and the behaviors around these rapid advancements in technology? The fifth trend that we're seeing is around health equity. So there has been a great difference in the type of care that those receive in underserved and lower income communities versus those in higher income communities. And how do we create health equity across those patient populations so that everyone across the country is getting a similar level and access and quality of care? There's a lot going on that's impacting the financial burdens of hospitals and health systems and provider groups today. And if you think about it, it's a very simple equation in how any organization makes money or delivers their mission, right? It's profit is revenue minus costs. And most health systems, many health systems are not for profit. And what that means is they don't need to have a huge margin, but you have a cost structure you have to cover, right, in order to be able to sustainably deliver care. And that revenue is based on price times volume, right? So how many patients you're seeing and what you get reimbursed for that patient care. And there is a pretty serious suppression in reimbursements to hospitals and to providers right now. So they're getting reimbursed less. Now, CMS is just announced that they're going to increase reimbursements a little bit, but it's not enough to cover the increase in the cost of care. So revenue is being pushed down for the healthcare organizations. Meanwhile, the cost structure is going up significantly. So the cost, because of the workforce shortages, it's a lot more expensive to attract and retain the same type of talent that they had pre-COVID. And so there's just the cost of employment is higher, and there's still travelers. I think we've gotten a lot better at getting rid of travelers and locums in hospitals, but they still exist. Those people are typically paid a premium. And so that also increases the cost structure. Another key driver of cost structure increase is the supply chain issues, also hangover from COVID, but there's still supply chain shortages for instrumentation, supplies, and the cost of those supplies has also gone up. So hospitals are being pinched really from both sides. So the top line is going down, the bottom line is going up, and what was already a really thin margin is getting suppressed. And so that's making hospital systems think about how can they deliver care more efficiently, or where do they need to cut back on delivering certain types of care. And we're seeing that too with some hospitals going into bankruptcy. Another dynamic, right, is there's the cost of debt, right? So as interest rates go up, and most hospitals have some sort of debt structure, the cost of that debt also is pinching the cash that they have to make investments in their facility. So it's just creating a time when we should be investing in innovation and how we do things differently. There's trade-offs in those decisions. Do you invest in the new technology that helps do more with fewer people, or do you invest in just making sure you keep the people you have? And it's not always that simple. And it's never that simple, but there's a lot more trade-off discussions when your margins are so thin. And we're seeing this, there was a ton of compression. We're seeing a little bit of relief there. I think we started in 2023 at negative 0.5% average margin across America's healthcare systems, the United States healthcare systems. As of the mid-year report, we were closer to 2.3% margin. So there has been about a 3% improvement in margin this year through some of these efficiencies and gains and workforce solutions that have been put into place. But it's still not a lot of wiggle room to work with. And that's creating a ton of pressure for the hospitals and impacting their decision making in care and investments. The number one goal of hospitals is to ensure that they're providing the highest quality care for the patients that they serve. And so, with these financial burdens, as a patient, you may be worried, am I going to get lower quality care? I think that's not the trade-off that hospitals are going to make, right? They're focusing on quality, and they're reimbursed to do that. They're also, as people go into healthcare, we want to provide the highest quality of care to the patients that we serve. So the emphasis is always on delivering really high quality care. It's just how can we do that more efficiently and ensure that we're giving still the right amount of access. So they may limit access to make sure that those that they do serve have the highest quality care. It's those types of trade-offs that may be happening in this type of financial pressures. Workforce issues in anesthesiology and nursing has existed for many years, right? It's not a new discussion, but what happened, there's a compounding impacts, right? So COVID really put pressure on people. It was very hard to deliver care, particularly surgical care in the times of COVID. And so a lot of people who were close to retirement or considering retirement retired. A lot of people stepped out of the workforce who were working part-time or alternative kind of scheduling or work structures. They moved out as well. And so there's just fewer people who stayed, fewer people going into healthcare. So there's just a supply issue. And simultaneously, there's some regulations that happen. There was some surprise billing and different regulations that have impacted reimbursement structures for anesthesiologists, for example. And so reimbursements are going down. There's fewer supply. And so they need to be compensated more because there's fewer of them. And so it creates a mismatch between supply and demand. And so the compensation has gone up pretty significantly, almost 30% for anesthesiologists and CRNAs in the last few years. And so there's just this additional pressure that's happening, that there's fewer that need to be paid more. So you're sort of paying the same amount as a hospital to get less than what you had before. And that's a hard pressure to deal with when you already have such thin margins. Workforce shortages is one of the most talked about issues in healthcare today. And it's not just the shortage, right? Which is there's fewer people to serve our patients in our communities, but also with all the turnover that happened. I was working with a health system earlier this week. They talked about since COVID, almost 80% of their staff has turned over with travelers and locums and bringing new people in and just moving people around. it's when you have that sort of turnover, you have to make sure that your staff feels safe, they feel trained, they feel onboarded and educated to do what they need to do. As the CEO of Surgical Directions, we're dealing a lot with surgical and procedural care. That is a high intensity department within a hospital. The stakes are high for each patient. And so you have to make sure that there's time, a safe place to learn and to be trained, um, where you have the support structure to go to with questions. And that takes some time. A lot of hospitals have implemented training programs like Periop 101, where they have a very smooth system to train nurses and new techs and that sort of thing to come up to speed more quickly. But the first focus is making sure those caregivers are appropriately educated, trained, onboarded, and feel safe to deliver and to care for patients the way that they need to and want to. And so that's an important part too about the workforce shortage. It's not just that there's fewer people, but with the turnover, we now have to build in time for training. And during that time, you might have to double up on some resources and that sort of thing, which is another cost structure. Also, you need to invest in well-being and mental health, right? There's so many additional pressures, especially when you're short-staffed, that you have to deal with when you're dealing with high acuity patient care, and that can be very draining on physicians and nurses. And so, where do they go to have that release, right? And so mental health, wellness, well-being, how are we making sure that people have safe environments to process what they're doing, process what they're seeing so that they can um, not burn out, right? And what we saw was a tremendous amount of burnout. We're still seeing that. And so investing in those wellness platforms, thinking about how you can do things more efficiently or smarter is another important component. I was at the AHA conference recently. It was they had a couple things that were on that trend. One of them was, and I've heard it from a few hospitals, they're setting up what they're calling gross committees. And gross is an acronym for getting rid of stupid stuff. And so it's sort of comical. It's a funny name for it. Um, but but it's so true. How much do we do each day that we do because we used to have to do it that way and we just haven't gotten rid of it? And so thinking about subtractive actions versus additive actions. And we've been in a very additive culture. Uh, but I think as you think about burnout and the pressures on our clinicians and on our staff, we need to really be thinking about being a bit more subtractive. Um, Also at the AHA conference recently, Daniel Pink spoke, the author of Drive and many other great books, and he said, he has a to-do list, right? I have a to-do list every day. I, write down the things I need to do, and it's so gratifying to check it off, right? When you finish it. But what is on your to-don't list, right? What are the things that you are not going to do so that you can be more productive and you can help your people be more productive? And I think it's important too, as you think about burnout, there's certain things we just shouldn't do, right? And an example of that is, never attend a meeting that doesn't have an objective or an agenda, right? You want to make sure that your time is productive. And so it's different things, right? Different tactics that we can take to help to ease that workforce shortage and ease the burnout that's happening across our healthcare providers and staff today. Cybersecurity is a hot topic right now, and I think a lot of people are trying to figure out what to do, right? There's cybersecurity insurance. There's a lot of effort on how you protect your data, who you share your data with, how that moves in or out of your systems, and how it interfaces with other technologies, and who you partner with, right? That Change Healthcare cybersecurity attack impacted a lot of people through their clearinghouse program, people that maybe didn't even know they were exposed in that way. And so there's increased pressure, and it's tough because it constantly is changing the way that ransomware, phishing, all the different spam and these viruses can infiltrate your system. They're getting smarter and smarter, and AI, which is seen as so helpful in so many ways is also just as harmful when it comes to thinking about these viruses and cybersecurity or cyber attacks. And so we need to be more thoughtful about it. And I think hospitals are in a tough situation because now you need cybersecurity experts and cybersecurity guidance and advisors, and that's another cost, right? That they didn't have, and you have to be hyper focused on that. And hospitals generally are applauded and awarded for having great clinicians and delivering excellent care. And now they need all these additional things in shared services to support that. And I think that's sort of going to push along some of this consolidation that we're seeing too. When you just need that level of expertise, and that expertise isn't cheap either, to support your cybersecurity program so that you aren't a victim of a cyber attack. And it's not even just cyber attacks, right? We saw with CrowdStrike just an IT outage, which caused a great deal of issues across all sorts of industries. Healthcare absolutely was impacted by that, but airlines, retail, et cetera, was a big impact. And so it's understanding the interconnectivity of our technologies and how you're introducing or protecting yourself from risk through your own systems and through partners. And so it's a very important consideration. And when you have patient health information and you have sensitive information and you have patients who might not be educated about these risks and what they're introducing into their own personal profiles can be very risky. And so this is something that we constantly need to be following. People need to be aware of, need to be educated. There's a tremendous amount of education that needs to happen by patients, by consumers, by employees. Everyone plays a role in protecting the organization, the hospital, their own personal financial situation. And the attackers are getting smarter, right, by using AI. And so we just need to stay on top of that. Advancements in AI and technology are so critical to how hospitals, health systems, provider groups continue to be able to provide accessible, efficient, affordable care ongoing. To ignore this trend would be a great flaw, because it is changing the way that we interact, the way we learn, and the way that we do. And so that's impacting healthcare. And we want to be understanding what that is, being safe about it, being safe about how we use it and testing it and learning. And I'm a big fan of starting small, piloting things and expanding as you get more comfortable and secure in how you're using that technology. But AI is one of the most exciting areas in healthcare right now. And Surgical Directions' mission is, how do we power the future of perioperative and procedural care? And when you think about AI in the actual surgical procedure, how you can use that to create almost like there's unmanned airplanes, almost an unmanned surgery, right? Where there's a surgeon watching it, but it's a robot that is actually conducting the surgery. And robots have been part of surgical care for a very long time. So it's not the introduction of robots, but what the robots, how much of the procedure that the robots are really can do, and how they can learn and get smarter and adapt to each different body or issue through collecting the data insights of multiple procedures. I think that's a very interesting area. Also, thinking about AI across that care continuum is going to be so important. And there is a lot of administrative costs in our healthcare system in trying to coordinate and communicate with patients, from the point of symptom to scheduling to see a clinician, to, let's say there needs to be some sort of procedure, to pre-procedure work, pre-op, during the procedure, post-op, 60, 90 days post, what you may need to do for PT or health at home. There's a tremendous amount of coordination that needs to happen. And today that's done by many different people in a way that isn't as consumer centric or consumer centered as it needs to be. Maybe it's calling on a home phone, or sending an email or demanding a home visit. That's not the way that all consumers want to interact anymore. And so how are we designing solutions that can aid in a cohesive and consistent experience across the care continuum? And an example of that is, within procedural care, there is the role of a nurse navigator that helps the patient in some organizations, helps the patient understand what they need to do pre-surgery. They're helping with the pre-surgical, the pre-anesthesia testing protocols, helping with understanding what needs to happen, where they need to be, when they need to be there for the procedure, and then how to manage and adhere to the care plan post-procedure. And that's a nurse navigator does that now. It's a person that calls that individual or sends text prompts. Sometimes there's a more automated system to that. But now with AI, you can do that almost as if it's a human talking to that person. It's not just an email survey, but a human who can answer questions. But it's not a human. It's artificial intelligence uh, uh, positioning themselves as that nurse navigator. And I think that can have a lot of good impact on costs and experience for the patient if done correctly. And so people are talking about, virtual visits and health at home, and how does AI enable that? And I think that's going to be very important. So there's AI on that consumer or patient experience spectrum, and also AI in how actually care is delivered. Um, there's a lot of tests going on too about just the diagnosis of patients and illnesses using AI. There's a tremendous amount of advancement in a very short period of time in that diagnosis space. And so, there's obviously still more testing that needs to be done, and human interaction and checks and balances. But I think that can also help a great deal. Um, Also, and I haven't talked about this yet, but it really works with workforce and the burnout. AI is helping our clinicians take some of that administrative burden off. So it's not just the coordinators reducing some of the administrative burden, but physicians note taking and updating the electronic medical record is such an important part of making sure the patient has the information they need and that there's coordination across that patient's care. But it's also a tremendous amount of work. And that work, they call it pajama time frequently, is done in that physician's own time, at home, at night. They're tired, they have to be up early for the next day of seeing and taking care of patients. And so automation in some of that administrative time and that note taking that gives you that energy or that time back to spend with your family, to decompress, to serve and be a great caregiver the next day. Health equity is a huge opportunity area in the United States healthcare system today. There is a lot of disparity between the access of care and the type of care that people can receive based on where they live, their economic condition, their gender, their race. And, all of us, just for the betterment of society, know that that is not fair, and that is not the way to create a healthy population, a healthy and growing population. And so, what can we do to improve health equity? And hospitals and provider groups play such a critical role in this. Not only do hospitals provide the healthcare, and help the hospitals and their affiliates provide the healthcare for these patient populations. In many communities, they're the number one employer for their community. And so they're also can think about it as, what are they doing as an employer to help improve health equity? But I think as you think about to make a big impact in health equity, community partnerships and corporate partnerships are going to be so important, because a lot of health starts at home, and there is a lot of home health initiatives and programs and organizations out there that are thinking about this. But if you don't have a roof over your head, if you don't have healthy food to eat, or running water in your apartment, or a safe place with where you feel physically safe to sleep at night, that's harder for hospitals and health systems to solve for, right? And so how can you work with the schools, the police department, other organizations within your community, shelters, to help address some of those health equity issues? But hospitals really need to be at the table. Health systems, provider groups really need to be at the table in thinking through this. There is also an educational component to health equity that I think is so important. There's quite a few studies out there too about how African American mothers, their pain scores are discounted. So if if a Black woman says she has a pain score of a 6, and a white man says he has a pain score of a 6, that they'll think that the man is in more pain than the woman. And so how do we educate people that might be an unconscious bias that they don't even know they have? And there's a lot of thought about that, and how you think about how you can create a more equitable interaction with people to ensure that we're listening, seeking to understand, and understanding the perspective that they're coming from. Because there's a lot of cultural differences too in where people may not be sharing their real symptoms, or be maybe underrepresenting or overrepresenting their symptoms or their pain. It's incredibly important to address and to better understand. It's not simple. Sometimes it feels like we can't impact it because it's too big of a problem, and it is a big problem. But what is the one thing that you can do, or is what I encourage people to think about. At Surgical Directions, we've worked with an organization called One World Surgery, where we are delivering surgical care to those that can't afford it. So it's free surgical care to those that can't afford it, and we're working with them to help them be more efficient. We give them our technology to help them think through scheduling and room turnover, so that they can give more care to the underserved, to the people who would not have access to that surgical care if this organization did not exist. And so it's one thing helping one population, but it gets us going, right? And it gets us thinking about how we can do that broadly. And so when there are these big systemic issues, I do encourage people to try to solve it in smaller bites. If you can solve it at that greater scale, then wonderful. But don't be so overwhelmed by it that you don't act, right? Just doing some action to improve it, even if it feels small, is bettering the health equity mission. And that's important. That's how, if each of us do that, a great deal of progress will be made. So what is the path forward? We talked about these 5 trends and how they're creating great opportunity areas or threats to hospitals, and in terms of how they can deliver great care for their patients in the communities that they serve, and provide a great environment for their employees and partners. And so let me take a few minutes to talk about then the path forward associated with each of these trends. The first one we discussed was the financial burdens and margin compression that is happening across hospitals, health systems, and provider groups. And that compression is coming from, right, reduced revenue structures and increased cost. And so one aspect that we can talk about is reducing waste. And so there is a lot of waste that happens in America's healthcare system. Wasted inventory, wasted supplies. We've referenced a study about, on a surgical tray that's delivered to the OR that has to be sterilized, transported. A lot of the instrumentation is in a pack and opened. Only about 20 to 30% of that of the supplies on that tray are actually used. And so how do we take each one of those items and reduce the waste? And I talked earlier about, doing that to don't list, or thinking about being more subtractive, or your gross committee, where gross is getting rid of stupid stuff. How can you start thinking about what are we doing that's creating waste, whether it's waste of time, waste of resources, waste of supply. Um, Waste can be in many, manifest in many different ways. And so, what are you doing to reduce that waste? And a lot of times, process reengineering, which takes time, but it doesn't necessarily cost money, is a very smart way to start about reducing that waste. Are you using the technologies that you already have as effectively as you can? Can you rework the surgeon preference card so that you're not introducing supplier instrument waste for each surgery? And so for that, I would say the number one thing is try to reduce the waste, or try to stop doing the things that you no longer need to be doing, being more subtractive versus additive. The second trend we talked about was the growing crisis around workforce shortage and employee burnout. And so there, I think it's about how do we create a good environment for the people that we have, the clinicians that we have? How do we make it a safe, healthy culture for our staff, our clinicians, our administrators across the different care uh, platforms? And so it's much easier to keep someone than to replace and find a new one. So find a new person or use a traveler. So investing in your own people is I think the number one path forward, and that comes in well-being and wellness, an environment of safety, building on your culture. How we behave, the behaviors, and how we hold people accountable to those behaviors sets the culture. And so thinking about those items or those tactics are very important in keeping a higher functioning workforce. The third component that we talked about was cybersecurity, and this is very complicated, and the attacks or the viruses come in many different fashions and from many different countries, and creates a lot of complexity, and we don't always have control over the individual patient or what they're communicating, or every single employee. And so how do we educate? How do we train? How do we create as many safety structures within our technologies so that we are limiting cyber risks to our organization? And there is a lot of really intelligent people thinking about this. And so I think collaborating around what best practices are, using associations that have some of that expertise in-house, and sharing that expertise across. We all need to come together to have a safer cyber world. And I think the more sharing that we do there, the smarter we will all become faster. The rapid advancement in technology and artificial intelligence. And so here, sometimes I think most people are already using it in some way, whether it's back office shared services, or in direct patient care, or employee engagement. So I'm just encouraging people to try it, right? Try it in a safe environment, going back to the cybersecurity components, but don't be afraid of it. There's a lot of advancements, and so it's hard to know what to go big on where. But I think just getting started with something, and using that to work smarter, right? And focus that on some of these bigger issues, right? Like the workforce shortages and the employee burnout. Like, how can you use that and prioritize that in areas where you're having the biggest problems? The last aspect we talked about was health equity. And as I think about the path forward there, uh, there are large systemic issues. And so I think hospitals are in such, and ambulatory surgery centers, provider groups are in such a wonderful position of bringing people together, and engaging with those that might be unrepresented or unheard in other aspects of their daily lives. But in a hospital, they are heard, they are seen, and they can be cared for. And so, how do you use that moment and that um, kind of moment that matters for that person to help connect them and engage them with the other services that they need? Is one small step. But also as an employer, and typically one of the larger employers in a community, how can you work with your community members to start making an impact on health equity? So it's an important part of what Surgical Directions does. We work with the most prestigious of academic medical centers, and then also, the critical access hospitals and the hospitals that are really serving the underserved. It's important that we help all of them, right? And care looks different in different places, and that's in as long as it's tailored to the patient population, that's a good thing, right? Versus having different levels of access or care. So I just encourage people again to start with something and to partner with their communities.